In British Columbia, the First Nations in particular have asked for parity in health outcomes, and that means taking a special look at health care and the health system, but also our approach to health. So we could be better organized in our health programs. We could focus on what the patient wants instead of on what the bureaucracy wants. So just to give you a simple story, if grandma needs aspirin in a small community, there are probably some things that we could do to help her get that aspirin in a cost-effective way and in a quick way. If we were to serve the bureaucracy in getting that to grandma, the bureaucracy would say, well, you actually need our permission in order to get that aspirin, and you'll get that kind of aspirin that we think you should get, and you'll get it when we're ready to give it to you. So, you know, there's a real difference in that kind of system approach, and so we can reorganize and be more organized, focus on the patient. Now, when it comes to the downtown east side, there are particular issues for the city that you wouldn't have the same as in a remote area. And when we think of First Nations and Aboriginal peoples, we often think of remote places. We think that, oh, they're going to have trouble getting medications. But in the city, that's not the case. There are pharmacies everywhere. So what are the particular challenges in the city? And one of them is that, is the city a place of risk? Is the city, does the city have something protective? And of course, if there's, for instance, a tertiary care hospital where you can get really good care, that's protective, it's working well, we're not going to be looking at it. We're going to be looking at the risk in the city, like, oh, if you're a young woman who's Aboriginal, First Nations, and you come to the city, and the risk of you being murdered or falling into the sex trade is significantly higher, then someone should do something. And that's what we do. We look at the special risks for urban populations.